Hi, I'm Dr. Andrew Tharp with the Vision Care Center in Evansville, Indiana. Sometimes I'm asked what makes a good LASIK candidate. The people that tend to like LASIK tend to like to be outdoors oriented. So it's people, especially if they're around water sports, whether it's boating or they like to kayak. But in general, things that are not very compatible with wearing glasses tend to be good LASIK candidates. People that are pretty fit, they like to be out on bicycles or running or just don't want to have to deal with the hassle of glasses and contacts, also very good LASIK candidates. Sometimes we find people that are so nearsighted that they, for example, wouldn't feel comfortable getting out of a burning house, or maybe they're a parent and they feel like they can't watch their kids at a pool without their glasses, or maybe they can't go to the bathroom in the middle of the night without their glasses. LASIK tends to be very helpful with those people. And then also people that have contact lens intolerance and allergies, sometimes LASIK is a big help for those people as well. What doesn't make a good LASIK candidate would be anyone that has a pre-existing eye disease. So people say with damage from diabetes or glaucoma, or even with a significant cataract or macular degeneration, probably don't have a good potential for vision. And that's what we're really after with LASIK, is to have good uncorrected vision when we're done. So you have to have that potential for vision before we can ever get started. Also, there are some eye diseases, like one called keratoconus, where sometimes the cornea doesn't have a nice round shape, but it's irregular and dome shaped, or even people with severe dry eyes are not always good LASIK candidates. People with immunodeficiency syndromes, they can be a disease, or it could be brought about by, say, cancer chemotherapeutic agents. You don't want to have an immunodepression with the LASIK because it increases your risk of infection. So that's probably not a great LASIK candidate. Also, we try to be careful with pregnancy and LASIK. I sometimes am asked by people that want to have a family if it's okay to have LASIK and have kids. And the answer is it's okay, but you probably don't want to do both at the same time. And then finally, you have to have enough cornea to support the LASIK. LASIK thins a cornea. We use a laser to resurface the cornea and thin it. So we have to have a certain amount of cornea to begin with. And that's one of the measurements that we take on everybody before we get started, so we know just how much we're dealing with. But if you have too thin of a cornea to begin with, probably not a good LASIK candidate.